Hello, everyone. I'm Sergey Badalyan, a medical oncologist from OncoDaily. And now I'm having Jennifer Lowe from Resonance. And we are going to have a conversation about Afro Children Initiative. And I'm super excited to have you here.
Yeah, thank you for joining our conversation. Thank you for having me.
So, Dr. Jennifer Lowe, could you please tell me more about Afro Children Initiative, especially for those who are new and don't know about the initiative?
Yes, of course. Act for Children is a global initiative, and it's a hospital-based initiative. So we work in specific hospitals all around the world. And then Armenia was actually the very first hospital that we started the initiative working in. And the approach is started with identifying the need for essential medicines and the gap for essential medicines. But then it extended beyond that because the recognition of the founders that worked on the initiative to say that just medicines alone isn't enough. So there's a variety of wraparound services that are involved.
Excellent. And we're super excited to have you here in Armenia School. So can you elaborate more goals like Armenia, innovation, and why did you choose specifically this country for your first steps in the initiative?
Yeah, Armenia has been a wonderful country for us to start with, not only because the people are wonderful to work with, they've been able to move things very fast. They were the first country to get the registry that's involved in the project approved, the first country to receive the drug. So they've been able to really push things through and get things done really quickly. But also, Armenia is a wonderful example of being able to work to identify the gaps that they have really effectively and then create in-house solutions to say, these are the problems we think we need to address, and here's how we think we can address them. So it's been really wonderful working with the team here.
Awesome. And I also work with pharmaceutical companies. Like, what kind of role do these companies have in your initiative, and what kind of strategic partnerships do you have so far?
Yeah, so the Afro Children Foundation is a partnership-based organization. So we have a lot of different partnerships. And so I'm the Chief Research Officer at Resonance, and we're one of the implementation partners for Afro Children. So we work on the strategic planning kind of perspectives, but mostly we work on things like research, data, and the medical implementation and education. But there's also a lot of other partners that are part of the initiative, especially pharmaceutical partners, which are key to the success. As we mentioned, this all started with the need for drugs and essential medicines that weren't available. So our two key partners at the moment are Sergey and Amgen. As you heard earlier, we already have Oncospar or Sparless that have been delivered here at the hospital, and soon there's going to be another drug, Blinatumomab, delivered from Amgen.
Excellent. And do I understand correctly that these partnerships also will affect Armenia in the same way as for other countries?
Yes, that's right. So Armenia has led the way, and we're very excited about that. But there's a number of other countries that are part of the partnership. So right now, countries that are included are Guatemala, El Salvador, Honduras, Armenia, Egypt, and Tanzania.
Excellent. And I would like to hear more of for your further steps, those or the next steps for Help for Children initiative, let's say, for the upcoming 5 years?
Yeah, so the big push now, what we're working on now is the quality improvement programs. And so specifically for Armenia, we did an analysis of what are the challenges, the problems, and root causes of those challenges here in Armenia. And the team, the pediatric oncology and the hematology team, the leukemia team, came together and said that one of their greatest challenges was in diagnostics. And so when we looked at the diagnostic challenges, we said, that there were a number of things we could do about that. So we've launched Afro Children has launched a quality improvement initiative here. And that's going to start in the next couple of months and go for the next 2 years. And that's going to be all about improving diagnostics, improving diagnostic access, reducing misdiagnosis. And that's through a multi-pronged approach.
Excellent. Thank you so much for the conversation and for your time. It was my honor to have you, and I wish all the best for the initiative, and we are super excited to see what kind of amazing blood issue you will have with our Armenian collaboration.
Yes, thank you. Thank you so much.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.